Some people, they don't even know they have high hemoglobin A1C, and they wouldn't take the step to get into a lab. So that's very helpful to get people back engaged in their healthcare.
Hello, everyone. This is Cole from the American Journal of Healthcare Strategy, joined by a really special guest who's been through so many technical glitches and reschedulings with me to join us. So it's really an honor. Dr. Kate Sowerwine. Dr. Sowerwine, can you please just introduce yourself and in your role in what you're doing currently?
Sure. Thank you, Cole. I appreciate you inviting me on. My name is Kate Sowerwine. I'm a board certified allergist, immunologist, as well as internal medicine. I started in the telemedicine path about 8 years ago. I was with a startup called Wellvia. And about 2 years ago, Wellvia was acquired by Recuro Health. So I've been the chief medical officer of the same group of physicians for about 7.5 years.
How many physicians is under your purview?
So we have all 50 states for behavioral health and urgent care, as well as virtual primary care. We have about over 1,500 licenses across all 50 states.
Wow, that's an impressive amount of kind of individuals, and then cascading from that are a lot of patients under your care, essentially, right? As the chief medical officer, you are having an incredible amount of responsibility. Back when you were doing your residency at Georgetown, and of course, I see in the resume NIH Allergy and Immunology Fellowship, impressive. Did you ever imagine that you would kind of be a chief medical officer at all? Was that ever something you were interested in?
Probably not back then, but my husband was in the telemedicine space and he was in the ICU telemedicine space. And I was very intrigued at what he could accomplish over the computer.
Mhm.
And so one of my passions is wellness and to take care of the whole person. And I thought it was amazing to be able to touch more people and to make policies and procedures for people across all the states. So I did join when I had the opportunity to join a startup company. I thought it would be real exciting for me as well as just a great leadership position. I do strongly believe that a physician leader should always be involved clinically. So not only have I been a leader to this group of physicians, but I've also done, urgent care and virtual primary care and showed them that I'm willing to jump in clinically anytime I'm needed. And I think that's been really powerful as a leader.
That is a big deal, especially when it comes to telemed, right? Because we kind
Mhm.
of think a lot of telemed organizations, the C-suite and kind of the enterprise leadership sit at a very separate level than the clinician leadership. And then that's kind of what I wanted to ask is when you first started, what was that interaction like? How big was the organization when you first came on board before it was acquired?
Sure. So back then, I think it was about 2017, we just had urgent care. And so my job was to make policies and procedures, grow our urgent care, grow our platform with physicians. And then before the pandemic, we added behavioral health, which was very good timing. And so we added psychiatrists and counselors, made policies, procedures. That was very important because then we hit the pandemic and telemedicine, telebehavioral health was essential during the pandemic. So that at that time we grew our physicians. We grew more physicians in the urgent care. Our behavioral health started, picking up substantially. And we were in the place to then, get acquired by Recuro Health and add virtual primary care. So it was a pretty fast growth. And it was really fun to be along the whole ride.
I bet because you've gotten to see kind of things start off from a very kind of simple level with urgent care, which of course urgent care itself is very complicated, but at the time a lot of people were doing that kind of urgent care, and then we've grown tremendously. Why? And this is a personal question.
Sure.
What has drew you to this kind of work? Because clearly with the growth that you've established, being through medical school, you probably could have gone into investment banking. And I say this with a lot of people, you know, more lucrative careers. So there has to be some part of the mission that's really driving you. What about it makes you get this satisfaction from your work?
It's deeply personal for sure. So, my mom is the reason I went into medicine. She had a lot of chronic diseases and had a lot of battles trying to get what she needed with the healthcare system. I was her advocate since I was 13 years old. You're not really supposed to be an advocate at 13, but she was about to walk out of doctor's offices because they wouldn't see her because she didn't have the right paperwork or whatever the referral was. So I'd help her navigate the system, and I felt that I wanted to be in medical school and I wanted to be part of the system so I could help others. And I didn't want to turn people away because they had, the wrong time or the wrong paperwork. it's sometimes a very difficult system to figure out. And so my passion was to go into it to help people like my mom who didn't really understand the navigation of the system. And I think she's proud of me now.
Oh, that's a big deal.
Yeah.
That's a big deal. What are you accomplishing at Recuro that sets you apart? And the reason I ask this is because, during the podcasts, we do speak with a lot of people who do the telemed space, but each of them does it very differently. And I try to address that early on in the podcast so that people don't say, "Oh, it's just another telemed organization." But from what we spoke with earlier before the episode, there's a lot of things that make Recuro very unique. What are some of those things?
So one of the things that's unique about Recuro Health is we like the mid-market, we like the employer-based, the brokers, the TPAs. We do really, really well in that space, and we customize. We have unique printouts, whatever needs to be done in that space, is we're able to customize that. And I think a lot of people in telemedicine are maybe walking away from that area. We're embracing it. We love to deal with that market. We take really good care of their members. Their members have access. We can see what access they have. And we can encourage them to use the psychiatrist or the counselor, whatever it is they need to take care of their health problems.
Why have others walked away? What's challenging about this market?
I think because they're small in group number, and maybe the larger telemedicine companies don't want to deal with such a small group. Where we embrace them, we bring them in. I think at Recuro Health, we're able to customize and put the groups together. And what we do for one group is so similar to the others that we can just group them together. And we don't mind taking care of a 5,000 member group. We don't need a 10,000 or 100,000 member group to make it satisfying for us.
So some of these other telemeds are going for that scale of 10,000, 100,000. They're really trying to get those. One of the benefits of that is the economy of scale, though, right? I know you mentioned that you are in all 50 states. You have a lot of licenses in those states. But has there been difficulty at all in dealing with a smaller scale of population? How are you able to kind of manage that effectively at such small levels?
We're able to manage it with our physicians. Our physicians are able to answer urgent care calls within usually 8.5 minutes.
Wow.
So we've been able to keep our satisfaction scores in the 90 percentile. So I think with those things, just adding more members at a scale that we're comfortable with has been great, and we haven't had to adjust.
I think it's because it's challenging. It's a challenging problem, right? Is maintaining the quality of care and the speed of care while also maintaining your physician's happiness that work with you. You mentioned that you've worked closely, sometimes directly, with some of these doctors. What do they say about Recuro? Is it a good place to work, and is there anything you've done to make it a good place to work?
So one thing about physicians is they're high burnout. Many areas are high burnout. ER, ICU, family practice, internal medicine. The primary care physician has a lot of high burnout. A lot of people in telemedicine, they enjoy it because they can take the job wherever they go. It's a more flexibility. And our physicians tend to stay with us because they like our platform. It's the ease of use. They can jump on and off. They can use it, anytime during the day, at night. And we also are able to use the different time zones to make sure that we have active physicians 24/7.
So physicians can live in different places of the world then, and then also kind of all adjust time zones?
We use US-based physicians, so they do have to be within the US. We
Okay.
can't take physicians that are overseas.
And is that a legislative policy requirement?
It's for billing, even though we don't bill the entities that would control that, just Medicare, Medicaid, CMS. We don't actually bill them. We don't bill Medicare, Medicaid, but we just, in case one day we do, we want to keep all physicians already and so that we don't have to weed them out at that point. Almost every telemedicine company, you have to be in the States in order to take their phone calls, including us.
Okay. But they can live anywhere within the US.
Yes. They can live in Hawaii. They can live in Alaska. And the way it works in telemedicine or in general is that it's where the patient is. So I have a bunch of state licenses, just like a lot of our doctors. So I can see you if you're in Texas and I'm in Virginia. So it's always where the patient is, which is the same across every single telemedicine. Mm-hmm.
And that's great because you have 1,500 licenses, right? So I mean, that's awesome. Yeah, that's a lot of locations and a lot of doctors. So that's awesome. Talking about kind of the expansion of services, started with urgent care, right? What was the next one that you mentioned?
So urgent care, and then the next that we added was behavioral health, which included psychiatrists across all 50 states, as well as counseling.
Wow.
And then about 2 years ago, we added virtual primary care.
The behavioral health makes sense because that is similar to what other telemeds at the
Mhm.
time. I think you guys got in a bit early, and like you said, it's a good time to get in right before kind of the pandemic. But then with virtual primary care, that is kind of a different area of challenge.
Yeah.
What how did you guys decide to move into that area?
At Recuro Health, we like to be able to offer at-home labs, which is really helpful. Some people, they don't even know they have high hemoglobin A1C, and they wouldn't take the step to get into a lab. So that's very helpful to get people back engaged in their healthcare. We also offer something called pharmacogenetics, called PGX, which gives you the ability to look at your genetics and how you may react to certain psychiatry medications or cardio medications. So that's
Wow.
also something we offer. We also offer testing, DNA testing for certain hereditary cancers. So we offer DNA testing for hereditary cancers. That's with one of our offerings. So we try to be across the board, and different people pick different parts of this. You don't have to always get everything. So I think it's important. Preventive care is absolutely key. Accessibility is probably the number one thing that we care about. Recuro is you can access us from anywhere. We do video for virtual primary care and behavioral health. We also offer it for urgent care, but most people want to use a phone. About 90% of
Mm.
people want to use just the phone for urgent care. But accessibility is so key and important. We also have a 24/7 call center in case you just don't know how to use any of it. You can still call and we can still help figure out how to get you connected with a physician.
Those are some very unique services that you've included with that, and I am seeing kind of the theme of accessibility be really important. What does this look like in terms of, and this is really my own ignorance to kind of how this section of the industry works. Like you said, that's probably a reason why people have left kind of or not really looked into this section of the industry. How does the finances work? Is this a value-based care model? Is this kind of a subscription model that these organizations or the groups, vendors are paying? Like, how does that all work, if you don't mind explaining?
So most of it is the mid-market or aggregator space, TPA brokers. So it's you pay per month per member. So like a
Okay.
subscription model. So that's how majority of our members come in.
Okay, so then your job really is to try to manage and give them the best savings on that per member per month rate.
Exactly. So utilizing us for a rash or a UTI, not going to the urgent care, also utilizing us for blood pressure checks or checking basic labs, whatever we can be utilized for to save a visit to an in-person doctor. And now that we've expanded to virtual primary care, there are many things that we can do to help prevent having to go in. And a lot of
Wow.
times we actually do work closely with someone's primary care doctor. So you don't have to have exclusively a virtual primary care doctor or exclusively a primary care doctor in person.
So I like that idea because of specifically kind of the labs. That's really something that I have not heard of before, and I have not heard of it bundled in this way. So what you're saying is you send at home lab test kits for things like A1C and hemoglobin.
So part of Recuro, you can have an at-home lab service, and that would be lipid panel and hemoglobin A1C. So that's a great conversation starter for your brand new virtual primary care doctor to see what your cholesterol is, what you can improve on, to know your hemoglobin A1C, to see if you're in the pre-diabetic range or anywhere near that. So I think it's a good baseline couple tests that you can do that are really helpful for a starter to conversation with a new doctor. And then we can always add other tests, and you can go in person to a regular lab and get any number of tests done as usual.
So the at home tests, are those, do they have to mail it back, or how,
Mhm.
how does that function?
Yeah, so it's just a couple of drops of blood on a card, and then you mail it back in, and
Wow,
then you have access to the portal that have your results, and then you can meet with your virtual primary care and go over the details.
that is
We
so
al-
cool.
yeah, we
That's
also
awesome.
send blood pressure cuffs to those that need it. I very very key is hypertension is a silent killer, so those that are at high risk, we want to make sure they have the access to cuffs.
Oh yeah, no, I mean
Mhm.
that's a huge deal for compliance and really everything nowadays. Those med adherence and then blood pressure is kind of the top issues. Um, so One of the kind of problems that I foresee a lot is this interconnectability when we start talking about virtual primary care. And it's that I have virtual primary care, which is headquartered in, let's say, Minnesota or something. And then the records are held somewhere in Minnesota. And then I'm here in Philadelphia. And then none of my specialists here can see the records. How are you working on kind of solving that issue and working to make sure that the information and records are shared?
That is a very complicated question. I wish there was an easier way. I think maybe one day there will be, but we'd have different abilities. But even if you are still connected, you don't get everything because they're not all interconnected. So unfortunately, we don't have a solution for that.
So right now, how that would work is the member would have to kind of give them the records off of the Recuro portal.
Correct.
And is there an easy export kind of function that's built into that?
Yes, it's not hard to get the records off of Recuro. We also can do it for you if you have any issues and fax them securely to your doctors.
Oh, okay. So in the case, let's say that a patient's been incapacitated or is just having trouble accessing their device for some reason, they could submit the request and say, "Can you help us out?" And then you'll fax them to the appropriate location.
Yes, absolutely. So we don't do remote monitoring. So you had mentioned that with the question. We actually don't have the remote monitoring, so that wouldn't be applicable.
Okay.
But if we had a patient that was in the ER and they didn't know what antibiotic they had, or they weren't sure what we had diagnosed them with, all they would need to do is log on and look up their portal. And if they couldn't do that or needed some assistance, they could call the call center 24/7, release the records, and we could fax them to the ER.
Okay, that makes a lot of sense then. So that does solve one of the issues of that virtual primary care, and again enhances the access. Why is access a problem for the clients that you're targeting? And what improvements have you seen from implementing your services?
Access is important across the whole US, unfortunately. There's a decrease in primary care providers. There's very long waits for new appointments. Getting in just to see a UTI, you end up having to go to an urgent care center with a long wait, missing school, missing work. It's very difficult to get in and out, even for the simplest rash. So we see lots of improvements using the urgent care for things that can be used for. The virtual primary care is a scheduled appointment. So you can schedule with the exact same doctor. You can follow up in 2 weeks, see how your antidepressant is going, see how your blood pressure is going. I think it's really important. We have continuity of care in our virtual primary care, but we also have urgent care if you just need something quick like a rash. It helps prevent any unforeseen time that it would take to go to an urgent care. It just decreases the patient's burden, as well as we take care of pediatric patients in the urgent care model. So it also takes care of children and makes them to be, it also takes care of the ability for a parent to take their child in.
Oh yeah, because that can be a huge drag, right, to somebody's day. Because then you're already trying to console your child, and then now you got to transport them, and that can be unfun, especially if they have some kind of stomach flu or whatnot.
Yeah, and you mentioned you trying to transport them. A lot of people don't have the transportation even.
Yeah.
That's a big deal. So being able to call and get a prescription, so many pharmacies deliver these days. So that actually takes out the ability of not having the transportation. So it's so key for accessibility, whether it's an adult or a kid, just to decrease, you're already not feeling well, and then you have all these other burdens put on you. And you also have co-pays when you go in, and they can be higher in urgent care when you couldn't even get into your primary care. So using us and using an urgent care or virtual primary care doctor in addition to whatever else you need is important.
You mentioned something that was really key to me, and it's about being able to see that same doctor. A lot of times what we're doing now with systems is we're giving somebody a doctor, and then we're having them rotate through residents to try to keep the slots open. But the issue is that you never see the same resident, or very rarely, because residents rotate, as you know, 5 weeks on, 5 weeks or 1 week off at the clinic. And then the other issue is, again, you're never really seeing your same doctor. What does that look like there? And what are the wait times for appointments with your same doctor?
So that's one thing that we definitely find very helpful for our members is they get to see the same doctor. Our wait time is about 2 days for a virtual primary care visit. And then you get to see that doctor on a scheduled visit. So they're open to, sometimes early morning, sometimes late evening, sometimes weekends. So it doesn't have to be the 9 to 5 schedule either.
So that means that after work,
Mm,
they're going to have enough appointments. It's not going to be that shortage that we have now, where after 5 p.m. all the slots are taken for a year out.
no, and we only offer our virtual primary care and urgent care, all these things I talked about. We only offer them to our members. We don't do direct to consumer or anything online. It's only to our members. So they have access to us, and that helps actually keep us, available for them.
That is pretty key, right? So that because I've been talking with a lot of telemed, every telemed company wants to come on the podcast, and so I'm asking some of these key questions. And you answered one of them, which is that it's member only within the kind of negotiated network that you have dealt with the larger groups, and so that's really important because what we found is once enough people hear about it, they're going to want to go on the website and start, and then all the appointment slots fill up, and now they're running into a capacity issue. But that will never happen with your organization.
No, if we need more spots, we have more doctors come on open spots, but we won't be flooded overnight by somebody heard about us and now, thousands of people want to see us tomorrow. That won't happen. If there are members, that's great. We encourage them to come see us, but otherwise, we're only available to our members.
That's great. And does that help you predict capacity as well? Are you using predictive analytics to identify how many doctors you need and when there needs to be doctors online or offline?
Absolutely. And that's why we keep our call times for urgent care always under 10 minutes, around 8.2 minutes or so. And our wait times about 2 days for primary care and about 3 to 5 days for our psychiatrist.
That is awesome. Wow.
Mhm.
And I know, I was recently in urgent care with my wife about a year ago, and the wait time was absurd, and then at the end they just told us to go to the ER. And so I'm sure a lot of people have had that experience, right? Where it's like, okay, I
Mhm.
have to go to the urgent care because if I don't, my copays are high, and then I have to go to the ED, and so, and even with some of the best hospital systems, it's just the struggle that they're facing is, like you said, the access.
Yeah.
What a great alternative to have. Uh, how can customers start looking into this? What is, I know this is an unsponsored episode, full disclosure to everyone. We're not sponsored. I just thought this company was great. But I want to ask if a company wants to bring this onto their employees, or someone hearing this thinks this is a great idea, how do they kind of get the conversation started with Recuro?
Sure, they can go onto our RecuroHealth.com website. They can look through there, see if there's anything that they like, they want to talk about, and then they can always reach out to myself, or there's actually a contact on the website, and someone will get back to them from the sales team. I'm not part of the sales team, so it's probably best to go on the website, but I'm happy to get back to you as well.
Oh, that's great. And then it's a full kind of process where they identify the needs, kind
Mhm.
of figure out what the services are. And then you said something key as well, was there are levels to what kind of services. And so that applies to the group, right? For example, if you didn't want to pay extra for, one of the services, maybe because your population, you identified it wasn't necessary, you guys work with them on that.
You can pick what you want. You can offer behavioral health and psychiatry, which I really encourage people to offer. However, you can also get it without.
That is smart. Well, thank you so much, Dr. Sowerwine. I hope we can have you on again. I'm excited to see where the organization goes from here.
Thank you, Cole. Appreciate it.